When we heard about the opportunity to bid for Changing Futures funding, Blackburn with Darwen Council was delighted to lead the bid proposal alongside the energy, drive and leadership within each locality that has moved at an incredible pace to get this programme up and running. In particular, Blackpool Council, Fylde Coast locality, Preston City Council, Central and West locality, Lancaster City Council North locality, and here, Blackburn with Darwen, who both lead the East locality and employ the core programme team to support and oversee delivery. Lancashire is committed to reducing health inequalities and improving well-being, which it is demonstrating through its community safety work, public health prevention work, health and wellbeing boards, and now through this Changing Futures Lancashire programme.
As the Cabinet Member for Health and Wellbeing at Blackburn with Darwen Council, I am delighted to join Denise in introducing this Changing Futures film outlining this groundbreaking programme. In this film, you will hear from the programme manager and the 4 locality leads about the co-produced delivery model, but more importantly, the evaluation and learning from the programme that makes it so unique. The client testimonies and the images of the brilliant Changing Futures staff carrying out their work in the first year gives us a great platform to build more success upon. There are so many people involved in this programme, and thank you all for your ongoing commitment to it.
Changing Futures Lancashire is here, now fully operational across the whole county, with an ambition to help over 1,200 people experiencing multiple disadvantage here in Lancashire. Lancashire was one of 15 areas to be awarded funding and received £6.5 million to deliver Changing Futures Lancashire until March 2024, with Blackburn with Darwen as the lead local authority. The Changing Futures programme nationally is a £64 million joint initiative by the Department for Levelling Up, Housing and Communities and the National Lottery Community Fund, the largest funder of community activity in the UK. The fund is for local organisations to work in partnership to better support those who experience multiple disadvantage, including homelessness, substance misuse, poor mental health, domestic abuse and contact with the criminal justice system. People in this situation are amongst the most vulnerable in our communities, often with past experiences of trauma. They find that getting coordinated support from local services can be difficult, and this can lead to greater risk of homelessness, ill health, and increased contact with the criminal justice system. This in turn can result in greater pressures on services that respond to crises, such as A&E, policing and homelessness services. The programme seeks to test new ways of bringing together the public sector and community sector to address cross-cutting issues and to drive the modernisation of public services for people experiencing multiple disadvantage, who are known as beneficiaries of the Changing Futures programme. The delivery model, including the referral process, has been entirely co-produced with Lancashire's people who have lived experience of multiple disadvantage and is evidence-based. We looked at the evidence-based practice from Blackpool Fulfilling Lives, ADA, Transforming Lives and the Rough Sleepers work, and we believe that this is the first time that a programme of this size has been rolled out across the whole of Lancashire as one programme, using an ethos of building on what is good in each of the 4 localities. The programme employs people with lived experience of multiple disadvantages as navigators and peer workers to outreach and connect to beneficiaries of the programme, the people we're helping. We are funding housing workers, mental health workers, drug and alcohol workers and other health professionals, including probation, to work in integrated teams alongside the navigators. The programme is also an evaluation, with independent evaluators overseeing the work to test if this approach really means people experiencing multiple disadvantage show improvements in their life. We already have feedback that this approach is working and people are getting better.
If it worked for these projects, I'll be honest, I don't think I'd be here. And then the support I've got, I don't think I'd be here. I could be. So I'm telling you, if it worked for this project, it saved my life.
The North locality, which covers Lancaster District and is led by Lancaster City Council. In the North, we've already formed strong local partnerships with services who may identify people with multiple disadvantage to make referrals into the team. Our multidisciplinary teams meet 3 times a week to determine eligibility of referrals. Our lived experience navigators are employed by the well communities and do outreach daily as well as carrying a caseload. Our outreach nurse is on hand to offer healthcare treatment and wound dressings to beneficiaries of the programme. Our main activity is in the most deprived neighbourhoods. The Navigator model allows us to spend time with people experiencing multiple disadvantage to try and restore their trust in people and that accessing services may work for them this time. It's an entirely person-centred way of working, and we can get that specialist help in a more timely way due to the Changing Futures funded integrated teams. We started helping beneficiaries in March 2022, and 3 months later we have connected to dozens of people and counting from Lancaster District. We have never had a programme like this up here before, so the opportunity to help people in this way is really welcome.
The East locality is the biggest, consisting of Blackburn with Darwen, Burnley, Hyndburn, Pendle, Rosendale and the Ribble Valley councils, with Blackburn with Darwen as the lead for the locality. The East locality was the first to get mobilised, and we started helping people in January 2022. We're now working with over 100 people who are known as our beneficiaries. Alongside the team of navigators who are employed by Red Rose Recovery, we also have specialist workers for minority communities, are working with the local council for voluntary services, housing workers and drug workers, mental health workers, health outreach nurses, and domestic violence support programmes. We also have strong links with probation, who are part of our integrated team. In the East, we built our Changing Futures service model on the success of previous initiatives, such as Transforming Lives and rough sleeper projects, such as the homelessness pods. The difference with Changing Futures is a consistent offer of service to people experiencing multiple disadvantage across all of the boroughs. In the first 5 months, we already have a few of our early beneficiaries who are now ready to exit the programme and get ongoing help and support from other services locally. We've had some really positive feedback from partner agencies about the progress that beneficiaries have made during their time with the navigators and also with the wider team support.
Changing Futures has changed my life.
The Central West locality covers Preston, South Ribble, Chorley and West Lancashire boroughs and is led by Preston City Council. Central West started beneficiary work in April 2022 with Changing Futures funded navigators employed by Red Rose Recovery and a multidisciplinary team of drug workers, drug outreach workers, housing, mental health workers and health outreach workers. Also services that specialise in adverse childhood experiences in addition to domestic violence services. We are building on the learning from the Rough Sleepers initiative over the last couple of years and using the Changing Futures funding to develop new ways of working across the whole locality. Our outreach teams are accessing deprived areas and forming partnerships with grassroots organisations who are connecting teams up to find disadvantaged people to help.
The Fylde Coast locality covers Blackpool, Fylde and Wyre boroughs, led by Blackpool Council. The Changing Futures Fylde Coast is building on the learning from Blackpool Fulfilling Lives programme, which was very similar to Changing Futures. The difference is that Changing Futures has an integrated team rather than a standalone team of navigators and lived experience peer workers. This means that people can access specialist help as soon as we connect with them. We are outreaching across the whole area, especially in Fylde and Wyre, who have not had a programme like this before. On the Fylde Coast, the Changing Futures service provides specialist support with domestic violence, substance misuse, housing and mental health support. Already, the Fylde Coast are working with nearly 100 beneficiaries and the established lived experience team is helping other services to explore new ways of working based on this learning.
So, to recap, Changing Futures Lancashire is a multi-agency approach to helping the most disadvantaged people here in Lancashire. People who have 3 of the following 5 problems in their life right now: substance misuse, homelessness or risk of becoming homeless, criminal justice involvement, poor mental health and domestic violence. Both perpetrators and survivors are supported. You can see that this is a huge programme. Changing Futures Lancashire is not just about delivering services to the most disadvantaged people though. The programme seeks improvement in 3 ways. At individual level, we are testing if beneficiaries get better. A robust independent evaluation and a national evaluation is gathering surveys done at the point a beneficiary starts with the programme and at regular intervals throughout their journey with us. At service level, we are testing the opportunities and challenges of integrated working across a range of statutory and voluntary sector providers to refine delivery models for services helping the most disadvantaged people. At system level, we are working on a series of system change priorities for Lancashire. These system change priorities have been co-produced with each locality and people who use services. Our system change priorities for Lancashire are how we can reduce stigma, how we can redesign services to better support disadvantaged people, how we can develop a trauma-informed approach across the whole workforce, how we can improve the experiences of people with lived experience in the workforce, how we can develop consistent language and reduce bureaucracy, and also how language itself can help or hinder progress. For more information about the Changing Futures Lancashire services, please contact the locality team manager for the area that you work in. If you think that you know somebody who may benefit from our service, please make sure that you seek their agreement before making a referral and follow the secure link that you'll see on screen. You will be asked to set up an account, and please go through the screening questions before completing the referral against the stated criteria, just to help us avoid inappropriate referrals. If you would like to get involved in the system change phase of the programme, please contact the Changing Futures Lancashire Business Support Officer for details on how to get involved. Thank you.